Thank you very much, Mr. Chairman. Thank you, Madam Secretary, for your service. And let me begin also by thanking you for the investment in the budget for the health professions. We had a chance to talk about the need for primary care physicians and nurse practitioners, and the budget represents a good step forward. And I know we have to do more, but thank you for what you've done. I want to focus quickly on two areas. One was alluded to by the chairman, and that's the cuts in LIHEAP. When the budget was being prepared, prices in the oil markets were a little tamer. They are now seemingly out of control. I know there's been some long-term reductions, or at least moderation in the natural gas market, but up our way, we depend almost exclusively on heating oil. And together with the 12% unemployment rates, we're anticipating a huge crisis next winter in terms of heating. And so these LIHEAP cuts are going to be very difficult to bear. Can you talk about how you got to this recommendation, and two, is there any way going forward that you have the flexibility to adapt to these increased prices?
Well, again, Senator, you and I have had this conversation, and I know that you are not only concerned but have been a real leader in the low energy assistance area. What this budget does, and again, I can assure you this is not an easy choice for anyone, is return the LIHEAP funding to the historic traditional levels. The LIHEAP budget more than doubled in FY 2009 and continued that in 10 and 11. This goes back to what was the historic rate, and it cuts $2.5 billion, which is a very significant cut in the LIHEAP funding. And I would not say that I have flexibility to, if it's moving money from somewhere else into LIHEAP, probably not, unless the direction of the Congress is aimed in that area. So I don't think there's an easy answer for this. It was traditionally the level of funding before there was a dramatic increase, but will it leave a lot of people who have relied on that help and support for the last couple of years in much more difficult circumstances? No question.
Well, just to reemphasize the point, we're looking at 12% unemployment roughly in my state. That was one of the reasons, I think, for the increase, the recognition of the difficult times. But the new factor is not a stable but potentially accelerating price for particularly heating oil. And we will have to revisit this again, unfortunately, I think, as we go forward, Madam Secretary. Immunization is such a critical part of health care. We don't have to state the benefits. When children are immunized, they're protected, and they save tremendous amounts of billions of dollars in avoided health care problems. The 317 funds, as proposed, there seems to be a trade-off now between the 317 fund and the Prevention Trust Fund, which was incorporated in the new Health Care Act. And the Prevention Trust Fund is designed, at least in your proposal, for infrastructure improvements. But that will take away money from the actual acquisition of the prescriptions, the vaccines that are necessary. And unfortunately, what we've seen in Rhode Island is a slippage in coverage for children. We've gone down from almost 90% to less than that. So can you just a moment, and I have less than a moment for you to comment on that.
Well, again, Senator, this is a critical area, and Chairman Harkin already mentioned it. What the budget proposes is the same funding level that we've had in the 317 program. And then, as you noted, an additional $100 million that would be spent out of the prevention fund for really what are more likely to be sort of one-time, whether it's school vaccination clinics or outreach efforts that states can employ. One of the challenges, as you well know, is that not only in Rhode Island but in states across the country, the health staff, the infrastructure to distribute vaccine, to do outreach, to have kids vaccinated across the country has been severely hampered and cut. So we are really trying to calibrate our resources and make them flexible to states. And I think that additional $100 million for FY 2011 is a critical component to not only up to 50% could be used for vaccination purchase, or for distributing for vaccine purchase, or for actually immunizing kids. And we think states can use that to really make sure that they're filling the holes in their own strategies.
Thank you, Mr. Chairman.